labs. And the history is based on what the patient tells you. So you would have what we call symptoms, how you feel when the disease started. There are some people when you ask them, oh, when did your disease start? Maybe minimum. And sometimes I'll tell them that if you're unable to tell exactly how it started, when it started, because it's the combination of these things that the person would listen to and then tell you that, okay, because it started at this time, this is what happened, and that, it's likely to be due to this before they can start treatment. So you have a role to play in how you are managed. So when you go to the hospital and you don't even know what happened to you, sometimes it's difficult. Even if the doctor will come to a diagnosis, it may take a while. And sometimes for certain conditions, time is very, very important. So I'd want to know, or I'd want us to know as patients, when we go to the hospital, what's our rights, what are our responsibilities, so that we can have optimum care. Prof, we can start. So this is from Ghana Health Service, the patient's charter. And the first one on the list is the patient has the right to quality basic health care, irrespective of the patient's geographical location. Trying to say that irrespective of where you find yourself, you have a right to certain basic health care. So because you are in Wa, you are in Chimu, or you are somewhere, doesn't mean that you do not have a right to certain basic health care. So in Ghana, the government is ensuring that everywhere you are located, wherever you are, you should have certain rights to basic and quality health care. So you realize that in the Ghana Health Service system, there's a referral system because there are different categories of health care. So there's a CHIPS compound, which is the most basic. Then we have district hospitals, we have regional hospitals, and then teaching hospitals. So that usually with the Ghana Health Service, you are expected to start from the very basic and then go through the system. But even with that, it's been realized that there are certain diseases that straight away you don't need to go to a CHIPS compound or a district hospital. You might have to access health care at a regional hospital or at a teaching hospital. So now there are referral systems, but eventually they are working to see certain disease conditions that straight away you can probably walk in to a regional hospital without necessarily having a referral letter, or whoever sees you can give a call to a teaching hospital so that you can be seen. So the first on the list is that every Ghanaian, irrespective of your location, should have a right to basic health care. The second is, and this is very important, but sometimes we deny these rights as patients, that the patient is entitled to full information on the patient's condition and management and the possible risk involved, except in emergency situations when the patient is unable to make a decision and the need for treatment is urgent. Say, oh yeah, yarefwa, now call hospital. Oh, pese near how? Ubet me be doctor, because I realize say most of the time, say I call hospital, yankasa doctor. Wako Dr. Etienne, waka train rama, you miss a question. We just take the drugs and then we go home. But that is not right. As a patient, no, Say, oko na oka wa asem wie na se doctor hwewa. We say doctor ususu say eden na ha me. Nia eha me ekwan ben ne ebefa so treaty, because there are now different ways of treating a disease. Say oko Ghana Health Service, they have the herbal departments, because gradually Center for Scientific Research are doing well with herbal medicines. Until now, the patient has a right to decide, say, when I get to a facility, I would either choose the herbal or I'll choose the orthodox. But that is beside the point. Inti okwa, you can ask, say, edenem ehame, send yebesi afaso treaty me, a drawaway no, ebi amefa, a whole side effects, den. Ninyano, the doctor is bound by law to have time and explain things to you. Enti mamu mayen adwin say doctor no ni neoye, because sometimes doctors are human beings and they can also make mistakes. Enti you also need to sort of take your health into your hands. Ask questions. If you can read, you go back home, read about it, read about the medication. If there are problems, you can go back and then get them clarified. So it's very, very important. However, when it's an emergency, that one, it lies with the doctor to do what is considered the best for the patient. For example, say, unfortunately, you'll be in an accident, na say, or you're unconscious. Say, any panel into me, emisa, said then, and I said, then a mano. So in that case, the doctor reserves the right to do what is best for the patient. But in the event we are conscious, now you have every right to ask what diagnosis the doctor has come to, and then the course of treatment or per se or the amount, and even what the complications of those treatments would be. Then number 3, as you can see, is that the patient is entitled to know of the alternative treatments and other healthcare providers within the service, if these may contribute to improved outcomes. I have sort of alluded to this point in terms of different categories of treatments. And now, patients, when they walk to facilities, have the choice to decide, say, obey you see this orthodox or would use the alternative treatments. And where no treatment exists and you are probably trying a certain treatment, the patient is entitled to know. But you realize that doctors and nurses will deal with patients based on how much the patient would want to know. And he said, a patient, that's a local hospital, now who make attempts to ask questions, they would also give you the silent treatment. Not every person would stop and then decide to explain things to you. But gradually, I don't know whether some of you have encountered, we are seeing some changes where people will stop in their tracks and then inform you what is wrong with you, what is being done, what the expected outcome of treatment is going to be. But sometimes you need a patient to prompt you. That's encouraging chairman to be able to give that explanation to the patient. The next one, number 4, is that the patient has the right to know the identity of the caregivers and any other persons who may handle the patients, including students, trainees, and ancillary workers. Minim moi Mako Hospital, especially the regional, even district hospitals. Now you see that doctors and nurses have started wearing scrubs, and they are mandated to wear their names, either on their chest or on something to identify them, so that you can identify who saw you. And so you can actually ask their names, and they are mandated by law to disclose their names to you. In fact, going through this, you realize that the patient has a lot of rights. But for some reason, I don't know, we used to see doctors as know-all. Unfortunately, now things are changing. It's no longer supposed to be the case, because it's being realized that they are human beings also, and they make mistakes. And because of that, patients should partake in their health and how things go, so that the optimal outcome can be obtained. So it's very important. And this is important because there are certain people who sometimes are quack. In fact, there's been instances where, and I'm sure it's come on the news waves, where fake doctors have been caught in various facilities. And some of these people are there to extract money from patients. I should say from unsuspecting patients. And sometimes the name is carried that doctors and nurses are probably taking money from patients. But these people may not even be hospital workers to begin with. So it's very important as a patient, say Udru Hospital, whoever is taking care of you, if you want to know, and it's good to know, okay, you'd ask them who they are in case they are not wearing any tags, what department they work with, and all that is very, very important for your own good. The next is this. The patient has the right to consent or decide to participate in a proposed research involving the patient after a full explanation has been given, and the patient may withdraw at any stage of the research project. There was a time na a doctor for a researcher, they don't inform patients. There's a very sad story where someone injected patients with syphilis. I mean, these were blacks. So injected them with syphilis, and then there was treatment for syphilis. But no one say or person or study how syphilis go through its stages. They were getting sicker and sicker and sicker. One more treatments. Just because a person or study how the stages of syphilis goes on in a human being. This is obviously not right. And then sometimes doctors are engaging in various research in hospitals. And when you say research. The patient's charter no estate said the doctor or the research team is bound to explain to you, because sometimes even certain drugs that are being used are sort of being tested. Okay? And don't you know that research team are supposed to explain to you, say, ebia, we research and I pese de will come home. Obetiasie and I say on tiasie. Na say opese uye bia na watiasie. But let me quickly add, say you can't say the all can research phone, so I don't just say you do ye guinea pig. Recently, me research, but with no risk to the patients. And the research ni say you more fra omunya bibia a friend say interception. Nti our friend for whatever reason or why na ne sno no ebi akwa share ebim na a block it. Ebia omuko omujo manaya moja wom no move they become very sick. The friend say interception meaning say obi wa ha ne ba enya bi pan and say obi enya bia. And unti me call kolebu no I realize say yetimi de ensuo egu bag him to send ye nsuo sini so no near the tube no ahye ne to send ye sebi yes no no but we dey regulated na ye running nsuo no na nsuo no a correct no nti ne nsuo ne ko shape no na assign atwe afrim ti me coin I realize say tube a omu use no it's a bigger tube. Then I read and realized, oh, you can even use a smaller tube. Because sometimes, a big tube anyhow, small tube. So the question was, I didn't try small tube. And even now share kind literature and so on. And for use small tubes and it's working well. So the question was, okay, and yeah, say obi ba, yeah, beba lots it. Omumbe use small tubes, omumbe use big tubes. Now I share whether it does the same thing. Say patient bar means mean fa mepe and can say me small tube. That patient needs to know. Say, oh, I have say tube way na you see. But because say yeah research no, and see yeah the tube way so I then and they should be assured say it doesn't offer any additional risk. Let's just say, you use small tube now, and you use big tube no. And no must say, or yari no, it be a bear can say, and I say bear kitwa. So that was the first bit. And then you should also be able to assure them, say what say obey you, say one say obey you. Treatment, I was here demand there. We are supposed to give it to you. And don't be bound, say, oh, and I'm say. Omuya research the man family one kwanko shema treatment I also with the mammy no find the mammy. It's not supposed to be like that. So you decide. Okay, me share risk now, me person me can home. Me person me can home. But okay say one person can home and not just say anyone should be angry at you. They are still supposed to treat you per the standard way of treatment. And it's very, very important. You decide as a patient. But sometimes it's also through these researches and it's new ways of treatment. In it doesn't have any additional risk and you can be part of it. I would encourage say you're very part of it. I'm saying I check Accra. Some people wanted to test malaria vaccine. You see, hey, you're guinea pigs. It's not like that. Because all the drugs are, you used to say, no, people offered themselves as specimen mechanism. And now, who said these things can heal and they do not have any harmful effects. And I must say, even all drugs in the system, people still continue to collect data because some of them have what we call adverse events. And it's a continual study. So see another drug, a bit me a chain the existing one. 6. Now say a patient who declines to participate in or withdraws from a research project is entitled to the most effective care available. I'm saying no medical I can say who decided say on your the facility is supposed to still treat you. The next one, the patient has a right to privacy during consultation, examination, and treatment. And in cases where it is necessary to use the notes of the patient's case for teaching and conferences, the consent of the patient must be sought. And I'm say but even in the teaching hospitals, because of the numbers, and it's a big area. Table no, Dr. Bakotiha, the chair is here for one patient. Another chair and so see her say for another patient. Patient ni bi nso no otie obi asem. Obi ka na asem na ehọ na naso ewo. O say udru ho na say onye comfortable la. Catch your doctor and say I want some privacy. And they are entitled to provide you with that privacy. So that's number one. Number two, sometimes, especially in the teaching hospitals, where your patients now the doctors would want to use you to teach, okay, and even sometimes call you for examination. It's also your right. You can decide, say you are not comfortable, you won't be available. Or you can make yourself available. Sometimes, we are training medical students to become doctors. And it's the patients who are going to teach those students to become doctors. And if we are not available for these things, imagine what will happen when the crop of doctors who are experienced die off. Then the new ones, how do they get their experience? Once and how can be asked, and I say, near Omuyano, empower, and say, and put you at risk, no. As much as possible, we should be available for some of these things. But again, we should understand, say, it's our right. If for any reason you feel that you are not comfortable, you can decline. And declining no doesn't mean, say, you shouldn't be giving treatment. You are still entitled to receive full standard treatments. Number 8, the patient is entitled to confidentiality of information obtained about the patient, and that information shall not be disclosed to third party without the consent of the patient or the person entitled to act on the consent of the patient or the person entitled to act on behalf of the patient, except where the information is required by law or is in the public interest. So we know near all can say, "O can wasem etre doctor." That doctor is bound by oath not to disclose that information to any other person, even if they have to make presentations and all that. They would need your consent. But me pese me to bibi ma asafono na me hwe mo adwen e wo we hu. Imagine, you are married to, let's say a man is married to a woman. Na oba no akọ hospital, akwa tests. Then it turns out she's HIV positive. Do you think the man has the right to know or not? What do you think? Okay, to obisi as a sebemanu, but obanisi on peso behu, and the woman has a right. Doctor named to me and young. So what do you think? Achobi wa again for.
Hello. Hello. I'm of the view say the partner needs to know, because the basic rule, they say, as a person, if I'm doing something and I have in mind that is likely to affect someone else, then I need to be careful, especially where the consequence would be adverse. In this situation, it's your partner. You will have sex with your partner. the person can be affected. On the basis of good faith, at least even the hospital need to let the partner know.
Okay. So good is coming from you. So even if that partner insists, say he doesn't want the husband or the wife to know, what really do you do?
It's a right, and every right has a limit. Every human right is subject to public good. Every human right. Now, what good are you doing to the husband? Do you protect someone's right by infringing on another's right? The answer is a big no.
Okay. So thank you very much. But unfortunately, this is still a lot of back and forth, especially within the what do you call it? The health. Yes. That's once the patient says, I don't want my information to be disclosed to my partner, you can't disclose that information. So what doctors and nurses try to do is to persuade the patient to allow that information to be divulged. Okay? I always would remind myself of a friend who I got to know was HIV positive. And she insisted that her family cannot know. Eventually, she got married. I don't know whether she told the man. No, all because of the stigma. She was secretly taking medications from a certain facility, and that was it. Eventually, she passed. But I don't even know till now whether the family got to know. And I couldn't also disclose because that was the patient's wishes. So these are some of the things, but it's difficult. But again, all in all, it sort of protects the patient so that your information is not put out unnecessarily. Because sometimes people can also use this for personal gains.
Yeah, by training, I'm a bioethicist. I'm a medical ethicist. In most hospitals in America, every hospital has an ethics committee. And these are some of the dilemmas that come. All right, just as the patient has a right to privacy and confidentiality, the husband or the partner also has a right to life and not be infected by a spouse. So in situations like that, when medical treatment staff don't know what to do, they refer. Oh, sorry. Okay. Monsieur Adia Kakra, your friend, medical ethics. Medical ethics, no, you call hospital, and some bebreba, yana, doctor for nim the ombeye, and patients nim the obeye. Into hospital, you will be a friend, ethics committee. Almost here, and yama, you call hospital, the yenny the enye. You do hold money. So, doctor very fair my ethics committee now. And near my woman said, Sir Obano, or home quine said, nothing be atono, or are you almost in Chirobiano? Nikunun so home quine said, or non so being fired dear, Uncle Canon, or non so our home quine said, or bonne better home buying. In Tiadena, we and a becuno. And I said, best on some bread, also a home quine. Enti Bibisa, but said a Dr. Kaino, the bar ethics committee, Obano, ye bebo wedding up a Sweden or Yashana say, or no one Casamoni Kunamania. So, because a honor, a bit is American, lawsuits or enti doctor, also you have an obligation towards your patient. You have the obligation to protect the husband said young fan Nti ye ka kire oba so on kan kire no no anka. The beban say be kan kire say well in order to protect the husband has a right to life. And it's on car and they won't so pese baby sue because one so what catch na one car nipa krone e infected roba be sue in the hospital into obligation to no ankoka so one car and the yebeka say that's what happened.
All right. Okay. Thank you.
Please let me add something. It borders on confidentiality, which is very key in every institution. But we are talking about situation at any partner. That's why we have the rule of privileges. Information between Obani and the Kununo is privilege between them. It cannot be disclosed to any other relative. And until that even the Yadoko Quarter, Asama when you Kuno Aka, and now when you Dr. Aka, it cannot be admitted as evidence. Inti ni Kununa aye kan huasem ahano, onyo obiya keke. Onyo obiya keke. Obani mami opa on kanchre no, opa on kanchre no, but oni ni kunu die, obetimi. There's an exception to that rule and privileges.
Mbacho ayi ba ko e ka ho no say me a psychotherapist and so. And so obi eba me ye obi counseling. Na o ka kire me say ofri medem ho a okwa kokum obi. Okoku ne yera na se nukuna na se obi a me wo ho kwan se me bo nipa kro no ho ban se ma money ho ban na se me gya no ma ne kɔ na okoku nipa kro a me ye liable enti ehwa no ayi ansana ye ne obi ebe kasa no ye ka kire nse well your situations be ha and some me no ka no ye nka nkire obi a ye between me no mienu nanso so se wo ka kire me se ube kumobi anasa ube abuse akwala bi anasa ya and they me catch us a no mema police for abam mema warning first na wunya boss there ese amunum ho a me free police for eme ye beche war because ukoku nipa kra me ye liable nti as a doctors and healthcare workers no more obligation to protect somebody so wanya then you become liable to it.
All right. Thank you very much, Pastor.
I'm say asem no enwa ye na ofane nana kwadwo aka no nana kwadwo aka on the legal aspects and ofa manfo nso aka wo the ethical point the medical ho ne say they have really done justice to it but adwuma bia no they are ethics of the profession so sa confidentiality e ka ho asemi. The ethics of the medical profession is say you have to uphold it at all time. It is part of your rule. So swa ibitumi ajo license, right? At the same time, no say faso so na bibisu sia ibitumi asiu said the no for can any hospital no so. It's on the legal aspect na kojo chire mu no so bia on the right no. You do have your right, but to exonerate yourself, no, the obetumi aye ne say adibia ba or say on so yeden opia ball no de to bi ayimu said the be obetumi aye den atwen ho afi ho right enye wo to me because of the ethics of your profession say you disclose to the other third party esan say enye wo to me so obey ntino na or say ethics committee will pass it on to the next person so that the burden of guilt will be taken away from you. And I think that is the best way we have to do because said the Nana Kodwe can now say Damanfokano. Nipano so a fan so he has the right to live, right? But once you know it's not in your powers to go and disclose that thing. I say Yeka say Ubi Yari, Nani Yari no we cannot do anything about it. It's young one paniama in euthanasia. It's your doctor, no, I just say you don't have the right, and I say it's not ethical. I say, Obe be paniama na ede, ewunu. Meanwhile, any patient no so that one so no is struggling. Na busi ya fo e ka say Dr. Bonipani no nyede ongu. in that sense, what are you going to do? So it is really, really a difficult situation. But when it comes to ethical, ethics is ethics. And a law, law. But also, more than say, whilst upholding your ethics, Bibia nyeden enko swao ema won so onyeden won lusu o license ade adwuma na ase bibisa medase.
Thank you.
That's it. Eda ka asema sisi a me hu se ye ya family ana say a young girl 18 years ye hu so HIV na guy bi na de man no si so France a guy de man de ono so de be ma we hu enti girl no ye ina kasa on be gi edokra onji de bia no na makra obo bra obo tutu bra so de be masa insesa de eda kan sisi na nim so osimesi owo bi no odi chima enti osi so bi ka so kokumu bi a ya wo say free police na mi so nim sa nipa so o say odi chima odi di mama mi so meyende.
Okay, Pacho ensa e was ro ahase.
Odi chimo e fa ho ban. If you say oh so be tutu said the defense of the scan and no tutu nso the social consequences. Enti e pa manu finjima. Oti ho eh prof we no anyum no mani abre. Oti ho uni adwen say so ware. Na emomu no say I love you. Na akunya esi ase wa na ape. Enti nye wadwuma say obi o es enu nti o be kunu afa nchima. Enye right way say ofro ba wo bia ba ekwan so de be bia menya yade gori a obenya eti abrochie onko strakia owuo no so tepa o ti ase onko kuni ba doctor fo nya guru obi a o kidney right na okoyi ana o ye busy o abi o de ma ni nua doctor so ye no na right no a okoyi ye no left na papa no akoyi left no so nti mesramo wo de esi nko de manu fanko meti hoyi ye pai afase a pra wa de ban mo mawiye baje nti de menkunu.
Okay, me nim se obi wo ho adwentre ne mama ebisai no, but I think say it's a very difficult situation because also the chin and how many people are you going to want? Say, I don't think you can even do that. You can't go public and say that this person says she has this disease and she's intentionally spreading it. I think say a honor and in the honor, I was say, but to begin with, you probably don't have to do that if you are not married, number one. And then number two, if you can't and you'd have to do it, then there are ways you might want to protect yourself. That's all.
Mpacho kakra mekane se sisiano yesi enjano no fanko but ono nso ne nkwaje hu hia enti ekwan me na ebefa so ebetimi ne nakasa a e bia bra na owom no obejai na wahu se all is not lost nyame betimi age no de na ebebe enti me fen se eno na ebetimi aye ne de aboa na nkwaje that's
KB kakra me de sosuni. I'm a lawyer there, but I'm sure Zenka lawyers know I'm meeting me aboy. There's something called harm. We inflict even disease onto the other. It's a crime. And as a responsible citizen, I think that you have a duty to alert the right authorities to ensure, say, saa nipa no and spread the yare no, because it's a crime to cause harm. And there is a nipa no cause harm, then he or she must be brought to order. And I think in the sense of being a good citizen, we can look at this from that angle. About Christo Afamudia, and what the end, Yahweh is standing there. Then so yes, no, acquiring so that we can achieve the best to also protect others not to be inflicted by such disease. But that's it.
Okay, I think Sir Kojo said, I don't know, Sebia, you need Faswa. But to every rule, there's an exception. So I'm not even going to look at it in the legal sense. I'm going to look at it in banking. Okay? Many me customer relationship confidential. Sika or the account, it's not my business. I don't have to talk about it. But there were KYC issues. There were anti-money laundering issues. Now, if there's any suspicion of fraud, the law allows me to disclose to authorities, not to individuals, to authorities. And so, Samuel Ohona say Ghana Police Service officially, Omar Trama may say they are investigating somebody. The law allows me to disclose the information on the account. And untina, for example, PEPs, or more political background and so on and so forth, you're just setting information. If this person out of honor evolution is able to come out to say that this is what I'm doing, then you have every right to report it. Especially when you have witnesses, okay? Because one thing our constitution allows you, and so who are locals, who are interested, and this person is going to cause harm to society. Even for a private person, you have a right to arrest someone. And the law gives you instances where you, as Cynthia, can arrest somebody. And as long as it's causing harm to society, is a security issue, you have a right to disclose. But how you do it, and to who, is not about going to tell your friend, or you have to speak to authority so they can act.
All right, thank you very much. I don't know whether, will it change? I mean, will this submission change if I say HIV is not a death sentence?
Technicalities, let me put it that way. But to the lay person, anybody who hears that this person is in this condition feels he or she is in danger. And that is why I'm saying that we speak to authority. Now, if it's reported to authority, AIDS Commission and so on and so forth, they have counselors. They might even counsel her on how to go about her business if it's prostitution without spreading it to others. And it's not so much as you going to kill somebody, but the mere fact that you are causing harm to others. Now, there are people who have conditions. When they get the virus, they can die. Others will not die. Others would have immunity or whatever. Your duty is to inform authority. That's all.
All right. Thank you very much.
And I think I can also give this scenario. A brave bidrui, first, you will be go to prison, and I say if you you will be palm latrine. A man for a quajanino. Bon say, if you are my prison, and was swa, and I need pebi no swa go to a good baby. Obi call court, echoes record, and they say, a good nipa hufi. I then yes, a nipa eswa ejanai, a kotugu. Court and my order says, Sadi, and he say, a cost of my muhabi. Mummy, found to yadie home. Wayne yadie. So we can think what the court will say if this should proceed to court.
Okay, thank you.
Yeah, Doc, one more thing. A statement you make is see as HIV and yet death sentence, How about so be argue say yes, a death sentence? Because so be HIV. Let's just say wouldn't back to in for the rest of the life. Enti se meti ho yi se bio se menyare menum nuro na enam obi so na kopim se mewu da bia msore a menum menni ho kwan se mennom sa duro no me wo ho kwan se obia emforce me ema me nkonom aduro a ense se mennom da bia manom a mewu manom aduro na mewu meboa okay enti se de be ya ye beti ase na etese obi aka kire me se mapoma tuo ato ha sa tuo no me be ko SESDAC na SESDAC for be ye omo se fom obi opportunity bia meku no enti so obi eti sa atsem no a na ye se well waka kire me no ma me mo obi amane enti se ma mo obi amane na se nipa ko no di tuo be gina kwan so na oba obi atwiniti na pow be na nipa aduonum waku wo mo me no a mete ye na ma amane no me responsibility and say masem ne sen em say some mass shootings are see nansen yi na akwara bi a wo ko twi tuo kokum nipa bebre ade ne na oye ne maame ne papa garage osori a san eniema na wo ye ne nyina no no munim sa akwara no ye suspect no ba wo ma anka ho hwe no akwara no kokum nipa no wie ne maame ne papa no so ya ba chi wo mo be aden so nyom na tutuo no na nyom na ye bibia aden ya ba chi wo mo because wo ho obia wo ho kwan se wote se obi ekoham obi a wo nipa kro ho ban se wanya you become liable esan se when it is said nipa kro won ne fa adwen se mokoye sa de no nti em se ai HIV asem no HIV asem na abamu
okay master pese okasa then you can
Pacha odiana o kan ase mapomatuo me de ato me dem kromfo bia obeba sta oba be wi amade no me de beku no wanam akwakofa na yes dwamani bia ono so wanam oya adwaman so wanam ne baabi wan fra wo sa ba be frɛ ni wono baba ya wo la wanya wo hwe na wakakofra no na wo dia wo so a what enti na wo so wanya bia wan fo so wana ne baabi na wo aba be frɛ no wahu enti ne de wo de ka no de wana ne baabi no wan kofra na sa wo ye free.
Okay, all right. Grace, maybe the last comment from Grace.
Okay, so what I would like to add is, just like Mr. Opon was saying, every profession, every institution have a law or an ethic that guides them. So with the health care, that's what the doctor was talking about, that you, the health carer, has a responsibility to your client or your patient, which is confidentiality, anonymity, and privacy. So it's not in your place. That's why the doctor was saying that you can persuade the client to disclose to someone, but if he or she insists, our ethics is saying that you don't have the right to go. So what Elder was saying, that you send it to the committee if they can also do something about it, but it's not in our place to do that disclosure. Never.
Thank you. So, number 9, also the patient is entitled to relevant information regarding policies and regulation of the health facilities that the patient attends. Next is procedures for complaints, disputes, and conflict resolution shall be explained to patients or their accredited representatives. Hospital charges, mode of payment, and the forms of anticipated expenditure shall be explained to the patient prior to treatment. I think I'll settle on this. And see, especially if you are going for surgery or other services, you can ask, say, Pachawaha Mabey, ebe cost me saying, so that you can budget for it. And so we hear a lot, maybe except emergency services, but we hear a lot say patients, baby, wa hospital, ya en operation and I en BBA, no da honum sa because the person cannot pay. But ideally, as a patient, if you want to avoid this, you should be able to ask. Especially for conditions and yet dire emergencies that probably you can wait. We call them elective procedures. And then exemption facilities shall be made known to the patients. Then the patient is entitled to personal safety and reasonable security of property within the confines of the institution. And then another thing I would want to dwell on is that the patient has a right to a second medical opinion if the patient so desires. Nunti say, we a patient now call facility. Wako ya shell. Osha senior treatment no esi kwa. You feel say you are not getting better. You have the right to seek a second opinion, and no one can stop you. Say, obi oha to say patient aba, or say I want to be discharged. Maybe a doctor for a nurse for say it's not right. The patient no he can decide, especially if it's an adult. He can decide. And crying the ebeba, and then I'll probably ask questions. Say, that is when it becomes a bit difficult, a bit dicey, and all that. But there's been instances that parents will fua omeja omuba ewo hospital echo, especially in the part of the country where men have lots of wives, lots of children. Sometimes it appears, not all of them, but a few, it's as if they don't care. Okay, and you realize say most of these things are motivated by lack of money. Oniska, and instead of finding ways of going about it, maybe I'll say, but as a patient, you have the right. If you are an adult patient, you are conscious, you can reason for yourself. You have every right to say, the way our treatment is equal, maybe I want another doctor to see me and decide whether what you are doing is the correct thing or not. And now sign bar, yes, he paid the ABN Panibu bet me a fool, but he has to see you. On to me and young Hoshe. So this is something as patients we should be able to use. If you find yourself in any facility and you feel the treatment, you have the right to ask for discharge and then, or even to be referred to another facility. Sometimes the reason is, you refer any other, but you should be able to insist on your rights and get a second opinion. So these are the rights of the patient. So what you must get as a patient. But of course, rights would always go with responsibilities. As a patient, what do you also have to do to ensure that you're being a patient, your care and all that is optimized? The first one, and this is very important, okay.
Sorry, on patients' rights, point 4. Okay. Yes. Okay. I think some mistake. Now, and maybe na my wife affair for now. Why na ni breath no na easy. Inti eba ahomachi bisa my friend e shen. Ti obefaye ahomachi be 3 a.m. Eko community hospital that time near around. E drew hono ena nurse no e twen adro so ode be wo my wife. Na my wife say be won't me injections are. Nurse ne bufuye. So I didn't know what change the ultimate money injection. And I say, may I right to know the kind of injection because I'm pregnant. ABSI injection can cause miscarriage. And to me, my own for injection, no woman. A be ye a crowd or nest, and the next I say, and your own touch no cry. There's no limited a cry, base 6 thereabouts, and a doctor Nangasa by. Or studies say, or beside my wife and say, because of Yana or call off Nintino, I didn't be crying now, oh, to me, na me catch any so, oh, say this, me call the doctors, maybe so I said. Let me pay baby. Okay, say, doctors, sometimes they see themselves as superheroes. And who will be cry, be how or no, or show, or no, nim, who patients no unim she. Sahona me show. And to me, can't say, maybe so I said, na me yedi. Therefore, beside me, wife now, Drew baby now, Obisana, I feel no. My wife and Kai at the chrono near no besides say and now for me and I'm so beside myself. And to me, so me imagine say your baby can be a mean casabi because me and me who near me show so that who makes me a man correct medication be bound to so beside myself. And two beside all soon kind and I'm so what beside myself. Oh, it told the beer not send a hospital. Doctors need a binum. Almost see a be cry a be shed until you be pa a hound. Wouldn't mean can enna watch your a droby cry mound. Wouldn't be misano because no nim. There was a time some years ago na minya serious a yibi a jumemo airport. Any a rushing me call airport clinic. Me could do about 4 to 5 hours. And then later, I me 7 coffee. And I drove you a trauma me and me to and that a drone was 200 Ghana is 1 tablet. Any other medications. Into me do I sat my friend be Dr. Ajiman. And I me chat at the standing and say, a draw say, BBC na me call airport clinic, no more this send away man. But could be a woman's expensive one, but I said, don't take it. Don't take this medicine. And no send me, or no say. So far a draw here. A bit me a kunkra, and Timenfa. And I'm going to say, ne draw ne board, a draw no much, no supana, ne board in wumpa, and I'll see my menfa, or see me see menfa. And power mamma fed no baku simple woman. Oh, it is sometimes a drone cranny panachua man over so who's a den a bear. Koda ya nano were free me. On narrating a story, what's ya, Jesus PD. No, so a new one so far for say, move friends samples. So far, near Hoshraman. And said be a didi more a dinner quite some but. Sometimes no man be who Ghana hano and I in Africa hano and no man be who I see utimi ya bowa anonti e hu kra wo mu ade no pesoka enso nipa no o ma kwa onu na onim na oye oh eno so etimi e ha adwen pa.
I say, I'm saying, you makes me I can say it's things are changing, okay. And as a patient, I will say rights, so that you can stand up to some of these things. And okay, and doctors being gods, it's not like that, or it doesn't have to be like that, okay? Because we are humans, we can make mistakes. But sometimes I'm not holding brief for doctors. I'm saying, I say no, the number of patients are just start or come by the time or be at the 20th, 21st patient, not no short fuse, start here, so Like as I'm not holding brief, but it's also not right. Okay. I think that patients should be able to ask questions for clarifications. Okay. And maybe I should also say as patients, we should understand the circumstances under which doctors work and also find nice ways of trying to get information from them. Now, I'm almost convinced that any doctor, any nurse who knows what he or she is about, say ubusana semaya ne bontai emfu. Omo mubuta efu no ebia no onye sure nti on pese obeba be den obeba be ha no. Clear example me share akra bi. Sometimes e wo mofra ni bia mema no omu sure no ya na emma fom. Ena o ba be man so na ne se ne sure na ma book says by 2 years a Maya was say we operation now the sure no ever true. See apparently or call hospital or when I catch and say oh or see doctor or no catch and say oh call a beba. Call beba no wa kuchenya ma praying about 4 years. Ma no sign call dog me buy say oh me say call a beba. By the time of Bakoli, now 12 years. To me, or by and maybe both say, I didn't know, or Bash now what's now, I was you me call hospital. Now, my boy sound call grandma doctor no both say, I didn't know, what can't you say me call never banama sign a baby. So obviously, this doctor didn't know. Okay, the first one didn't know. When something doesn't sit right with you as a patient, seek a second opinion. Like I'm saying, doctors are not gods. And you realize, no, there are a lot of specialties and subspecialties. Ghana, we train everybody in everything. But after medical school, after house job, people start branching. So there are now specialties and subspecialties. The person is still dealing with a very old literature. But because and sometimes he wouldn't even read. He won't tell you go and come and check. Whenever something doesn't sit right with you, make sure you get the right person and you check. And yes, sir. So I think it's very important as patients we seek second opinions. Until that, seek another opinion, and we are supposed to attend to you. Responsibilities of you, the patient, providing full and accurate medical history for diagnosis, treatment, counseling, and rehabilitation purposes. And as a patient, you are bound. In fact, it's for your own good, okay, that you provide history. Anyway, I say prophet has no honor in his own home. And I started I was saying, by the time I'm a call, third question, oh, me but that is not it. There are 1,001 things abdominal pain. So it is how you describe the pain. And the Beman Nipakrona who said pain no because of this or because of that or because of that. It's very important. Obi or of course people say started dabaya or say onkai. So onkai or person doctor no nyama addiction. Na near how it doesn't work like that. The more history you provide, the better the person is able to make an accurate diagnosis. In sema obeka fa ohono ena nipa no betie ede baako mienu miensa aka bom atre se we na ye wo anase we na ye nti it's very very important. Nti ebi krampo diarrhea so start feeling somewhere they document it. Because it's very important. That is how we make diagnosis. Sabi ya me can say aboa na wontumi nkasa. Ti ono de veterinary officer hwena ohwese ne ewesi aye boson no ohwena o say okay bi ase na ye na na ase na ye no. They may get it right, they may get it wrong. But nipa there, you need to be able to provide your history. Oh, a statue say, oh, time say, and eba, a yemi say, because we call them symptoms. It's a group of symptoms. Send ye see starts here near the adeno, and a ebema yetumi ehu. It's very, very important. Say, ye be hun ye na yetumi akantre doctor. And now, I don't know whether the doctor was aware. I don't know whether he told the person, and I still or signed it, I can't go into the story and all that. But we should be able to tell them, say, oh, we usually call it past medical history. I go to hospital for any reason, or or sickle cell, or asthma, because there are drugs that can worsen some of these conditions, or diabetes, or hypertension. The doctor should be able to know. It can take care of some of these things. It's very, very important. Then requesting additional information or clarification regarding the patient's health or treatment, which may not have been well understood. We have talked about this. Complying with the prescribed treatment, reporting adverse effects, and adhering to follow-up requests. There are some patients or hospital way or federal penebibiyana nanubuofu onko hobie no okoba before fraud. It is good say you go back and report it. Say me federal say and a year me. You know, it helps the doctor not to be able to change treatment to suit you. That is one. Number two, there are patients omuko ni bia ne hoton ne ka chen say bia bra okọ na pe ni views ne hoton ne pe onko biem. By the time our sign be kono na ebia lots of complications. Anunti is very important. Say okọ ma review data. Say u feel better mpa, at least go back and listen to what the doctor has to say. Sometimes ebiana condition no chronic, and you need to be going from time to time for refill of medications, for other investigations and all that. Especially more hypertension, diabetes. You need to be regular at the clinics. Obi ohwa okoni ema ne dro ba kwa na watiada. Esan ya no ayeden akwa akoto for maybe a year or two. You realize that it gets to a point, maybe a drone at the man, it needs to be changed. And until asking for review, maybe certain labs have to be done because this hypertension, diabetes can be affecting your kidneys over a long period of time. See, from time to time, also call running labs. You say, okay, it's working, we need to change or all that. Obi ohon kobi ono abeton rona all because or say okwa obechene to ase. Line tin obekwa kodisu sa okohu doctor and so very short time. But we should be able to go for these reviews because it's very, very important and it's our own rights and it's our responsibility and it's good for optimal health. Number 4, informing the healthcare providers of any anticipated problems in following prescribed treatment or advice. This is also important. Say, Drobi, now himself for whatever reason you can't take it out. You need to let them be aware so that they can change it for you. A very good example is there were in RA antihypertensives as Sebietimi, Emma, the way they're able to function, no echo from Kakra. Tibia, for whatever reason, the amount said really be pain. No one sign for hospital near the Mawa. You just need to draw the attention of the person. Oh, if I'm far away, no, say. And there are different categories that can be used so that it can be changed for you rather than no make up your mind say if you are okay, it doesn't help. If you have any challenge, maybe I am more say, oh, sorry, 2 a.m. Now, if you think you can't do it, you have to let them know. So, oh, if I mean to mean sorry, 2 a.m. Are there any other options so that this can be discussed? We should be able to become very good stakeholders in our care. My doctor no, or can be or you think it should be a challenge, you should be able to raise it so that you can discuss and eventually come to a conclusion and favor you as a patient. And obtaining the necessary information which has a bearing on the management and treatment, including the financial implications. Acquiring knowledge on preventive, promotive, and simple creative practices, and where necessary for seeking early professional help. Maintaining safe and hygienic environments, respecting the rights of other patients, and then protecting the property of the health facility. Quickly, let me go on to consent, especially for little children. What the Oba Ako Hospital, and also be the Neba Aba Hospital. Oba, you make a diagnosis, you starting treatments for whatever reason, or say, or person the Akrano Ekofi. And I say, let me bring it home. Accra in here surgery. And that surgery, okay, Accra in here blood transfusion, let me use that. That blood transfusion would be life-saving, especially for some group of churches who don't accept blood transfusion. What do you think should be done? As a parent, should we respect the parents' desire? Say on percent nebano yebeman moja, or you think the hospital can go ahead and transfuse such a child?
Sasemi, a children who are Muna Bessa Bisamo. If you say a common thing, I will yema muha. And so many say, dear Mupapa, the same Cambaji, some of Rayinqua. Mojamano, I don't quite acquire some first one, but me dear man on Quana. Say, some quantity. Mr. Samuel Sanfia Quafo Frosso. Na, ye, common. Ya, Gideon, a very cacra. Eti, ye bet watch him, mamma, the met for mamma. Set emotion on our Dacolana could see a coo. Mona mo camo ethics as him. All professions, Sebo Jana, the man will be Yanqua. Ubusa papa ni yede odi odaba na beto no kofi obaba no amar moja no nyankwa na obefa na ade ekọ e ka bi na ho a na ade abọ no se otimi a fine wentimi antua na mo de aba charities for ho na ya boa mo na ye jai sa de no ma awofo on their faith suspicious umbe kunkum ya manasa.
Okay, thank you.
That's it. I'm say Nkolaye yena ya said it. And yet parents so akola bia ye Ghana dia. And yet parents no kwa wo dia. And it say parents busy one predwa Ghana ye all right so say transfuse akola no whether the parents want it or not. Yeah, well, right, so say, ye transfer to Akola because Akola ye na ye di. Ain't I see, so who will be the banners or far quine boniswa, who to meet Tintino. Ain't Akola bia ye na ye right. Say, my men in prayer, who bet me now for police station.
Okay.
Antino, not yes. Who had been an about 18 years. Daughter said, well, money which I saw be. And on to there be yes, somebody yet. And on the bunny beside the papa and to him move. Sa to know ye. Well, all corporations are quite there. As I'm buying trust and cost yes. And a baby. And I open food means, oh, yeah, the obey. Obi our Nimwa. Yan a prison. Oh, here, my jazz will be. You wouldn't see Debbie. And who we are top. Now, to me, and send a come out on you too. Oh, ain't you know, I think I'm banning Nancy home. Says anything. Now, who him with the and parents, no, and I think a money muja. What is here? We have a very cardia, parents, no, and I said, or money muja. And Caber better. But one woman is secret, or no one got a muja and some from Antu. Don't hear or some bonny at this. I didn't hear Dr. William Mr. Daughter for you preach on first, and then inform you because may catch you say, you're more so crouching present. My people had diabetes. Any mujambo, so no hospital. Or catch a daughter to me now, Cofodia. Daughters in Humilo, Nimricanum. Or who ye, we are Ben and Ness in Iban of you to go here, or son of me and Kabu. May I see a 4-bed screen yardina, or true do mammy. I drew on me mini BP, and because I'm so fucking way me the coin. We bring him your say, I want to murder Mr. Debbie. No, or say, or check ya, or tetanasi, or check his hair, no ma, what I say. And two daughter for so do what he said, Casapreco, and over work or some other precu. What if because one, because I am the set, one ma authority say, oh, patient, and quano, every fluence, and so was my idea, Ubusa. But he hunti, daughter Naka. And I hear me, I say, Anna Mumbu said, Yame Nodi, says, he do me a few gun hanging. There's a cancer and sword also. It is no way and then. Say, I didn't say, name to moon me idea. Cause Adrian Fuma idea to me, and Adrian Panto say, I did William Yasamoa. And the daughter for dinner more yet. Fair Adrian Fu any pity. Nay, I did why I did be Yasa. Titu Colano. Nancy Mika, you be saying, Nancy Miser. Now, I didn't know, say, cancer. They send to moon papa. Nancy and your mother to me, dear. I think our mom and a catastrophe. What you say? Wouldn't mean to me, the room. All the same Perry and your bonnet, Macroni and your bonnet. But one and a candy woman, and it's parties on the woman. Now, Colonel Dia, Nigeria for when it is so bad, the same to me, a margin up picture, Major Mark and wine. As the near Marble Domino, why you that? Sacrogin.
So there's a hand. Yeah.
In my point of view, the general rule is say a minor is subject to the care of the parents. So the general rule is say with minor, you need to seek the consent of the mother. But there is also an exception to the rule. As a doctor, per the oath you have taken, you owe a duty to save life. So this one, I think the doctor, you also have a discretion. And the English law is clear. The position is clear. The doctor can take the stance and say, I will save the child. But with Ghana, it's a bit gray. The healthcare sector, we are still developing it.
Okay. There's a hand behind you.
For me, I really feel it shouldn't really count on the perspective of the parents, because number one, the main reason why the healthcare was set up was to save lives. So if the parent is against the fact of you saving the child's life, I don't really think it counts, because if there might be a reason why they don't want to agree to the blood transfusion, like the Jehovah's Witness, for example, they believe that blood transfusion is a sin. But if there is a case that the person might die and then you can, it's not like you don't have the resources or anything, you actually can save the person, then I don't really think the parent's opinion really counts. It's up to you, the healthcare professional, to step in and at least save the child's life.
All right. Great. Thank you.
Bacho, baby, yeah, bomb didn't say about protected healthcare worker. No, in situations like that, especially with Jehovah's Witness, now the case no echo court. Into the court, judge no Emma order say infuse ni pakro. Now why won't me foul pim into no a bibisa na say court a judge in Emma order say infuse no. Okay,
thank you very much. So usually that is what is done. Usually the doctor would call the hospital lawyer, inform them that, okay, this is the situation and all that, and then it's usually done. And yes, parents must give consent for their children to be treated. But in the event, ABR, for whatever reason, a parent refuses to do that, like Mommy said, no, children are for the states. So the states is able to come in, take over, and treat the child. Just that sometimes it's very difficult because imagine Papa no ejane ba ho say ene say o ma no enye ne obeya or their cry no ache hospital, no, you know, and all that. But these are the things. Since the very most important, and say we have seen, say, as patients, we have rights, we have responsibilities. In a very nice way, no, let's be partakers of our health. Yes, sir, it's no longer like that. Now, if you can read, go on the net and read about your condition. It helps. Okay, you can ask all your questions, you can get clarifications for them, and then it can improve in your health care. Amen. Okay, I'm saying. Yeah.
Pacho, maybe a question because of what you just said. Now, normal surgeries, in him say, Moma, okay, for married people, spouses sign consent forms. And even for the normal person, a family member has to sign. In a situation where none of these people are ready to sign.
They are not ready to sign.
Yes. In your experience, what do you do?
But the adult is ready to have the surgery.
Yes.
It will go on.
All right.
So once you are an adult, you can reason, you are conscious, and you say you want something, it will be done. Okay. Whether the family agrees or not.
Okay.
It will be done.
That's fine.
Yes, if he's not, so if it's an adult and it's unconscious, then you need a relative to sort of step in. But if it's, yes, or if let's say someone who has a mental challenge, okay, then you need sort of another person to consent. But if the person's faculties are okay and can make decisions for themselves, they can sign.
They would still sign.
Yes.
Right.
Yes.
Because you would have to cover yourself as a doctor. If anything should go wrong, and sometimes things go wrong, and that is why we go through these processes. What are you doing to protect yourself as a doctor so that in the case of the child, the father says, no, I won't sign, nobody would sign, and then something goes wrong? How do you cover yourself?
So in the case of the child, like I said, we immediately would call the hospital lawyer to sort of get an attorney to say that go ahead and do it. So that, and of course, there will be a third person to explain the complications of the procedure and all that. Say again? I can't hear. Yes, they are documented. Yes. You document all these things so that in case of anything, you are covered. Yeah. Thank you.
I think one thing we should also not lose sight of is that consent must always be given in good faith. That should drive it. Indeed, whatever it is, the consent given must be born out of good faith. And I'm so happy with her submission. Now, Elder Kayano. There have been instances where court has mandated medical professionals to proceed based on their view on the patient. So, I mean, these things I don't think is really novel or is new in our health sector. So I think it's in order. Thank you.
Just a last question. You have patients' rights and responsibilities there, but may say me who the rights and responsibilities. So, say if the facility have the right, say patient won't mean to Yanika, about the hospital or ya broker guswa ye huna busia phobia say be nesia bonten say onko because boy kadodo metro mana duane di waje mpanso so aye den akantan so entino ye nesia bonten say onko danso. I'm asking this question in relation with the Winneba case, you know. I don't know what has happened to it now, dear, but do the facility have such rights? So, obin to Yanaka, Yahenawi, if he say in nice mission, you know, Uncle Fee, the Humberto and sometimes Grano, ye who said Hontono, but we can't do anything. Tikofiko, then they just throw the patient out there, sir. Do we have anything of that sort?
Okay, thank you. I'm saying now a CNO was quite unfortunate, but in hospitals we have social workers, okay, who are called upon to sort of intervene whenever there's a patient who don't have money or something, and they are supposed to get in touch with relatives and sort of find ways of settling these bills over a long period of time. So I really don't know why. And it even appears that in the instance of the woman who died, there was a social worker involved. As to his role, I won't be able to tell. But I know a committee sat on it, and then a number of people have been referred to the disciplinary committee to go through disciplinary processes. That's, I am aware. I think the ambulance driver, the social worker, the matron in charge, and a few others were sort of convicted to go through disciplinary process. So there's a social worker or, yes, department to be able to sort these things out. And they come up every now and then. They can't pay their bills. So you talk to the mother or whoever is involved, and then they agree that, okay, maybe this is how much they'll be able to afford on a monthly basis, or and then they are allowed to go, and then they make these payments, and it's over a long period of time. I mean, everybody owes, including the country. So that's it. Thank you. Yes.
In case, like, an adult wants to have a surgery, but none of the relatives are ready to sign that the surgery should be performed or anything, if something happens to the patient, is the doctor supposed to bear responsibility for it?
No. So once you're an adult, you don't have any mental health challenges. Okay, you can reason, you are conscious, you know your left from your right. Once you give consent, that consent is enough. You don't need any relative. So I think in Ghana it's 18 years and above. But let's say if you're a child, so before 18 years, we have what we call an assent from the child. So if you are below 18 years, your parent or your guardian would have to give the consent on your behalf. But if the child is old enough, like how old? Okay, I won't ask your age, but you are not 18, right? Good. But you are old enough to understand whatever surgery or whatever is going to go on. So the doctor has to speak to you to get your assent to whatever is going on, plus your mother's consent before the surgery or whatever procedure can go on. Without that, the doctor cannot go on. But once the person is an adult, 18 years and above, knows his or her left from his right, once he gives consent, he doesn't need anyone. But like Jerry also said, the consent has to be in good faith and has to be detailed. Okay? And the person, even sometimes you need to give the person time. You give the document to them, they go home, read over it and all that, and convince themselves that they are not under any pressure whatsoever to sign this document. So they give their consent and then it's signed and that is carried. Thank you.
This is the last question. Yes. In case, like, you said before that if the patient is not comfortable, they can seek for a second opinion, another health professional.
All the time.
In case the patient, has like a relative who is a health professional in another like hospital or something, can that person perform the surgery in like that particular hospital?
Okay, so usually it's not ethical for a relative to treat a relative. That's a general principle. So if my son is not well, I'm not allowed to prescribe because there's this emotions that is attached which may sort of blind things. So it's not allowed. Okay, more so surgery. Though I did my son's circumcision, but that is it. So it's not allowed. Okay, so yeah, essentially that is it. Okay, so you can seek an opinion. Let me just give a typical example. Recently, one of our nurses in our ward, we am in a pediatric surgery center, and there's an adult nurse who went to hospital and was told that she has appendicitis. And she wanted us to do the surgery because she's been with us and she was more comfortable with us. So I called my boss, and he was like, no, we can't do this. And things can go wrong. And if you do this and anything goes wrong, you can't. Pediatric surgery, what are you doing with an adult? Okay, so all we did was to call our adult counterparts that, oh, we have a nurse who has, and then she went there and had the surgery done. So there are certain things, when you do it, you are just inviting trouble for yourself. Okay, thank you. All right, so thank you very much for your attention. I think you can close us.
I believe today we've learned a lot of things. The things most of the hospitals, they paste it all over. Patient's responsibility, patient's rights. I think most of us hold on so much with our rights and not pay attention to our responsibilities, but we have responsibilities too. And looking at